Reactions have continued to trail the recent cases of snake bites and poisoning in the country. The Senate has called on the federal and state governments to make it mandatory for hospitals across the country to stock life-saving antidotes. Lawmakers say many of the deaths recorded in recent months were preventable. Tijesu Adeoye reports.
Concerned by the growing number of snake bite and poisoning cases nationwide, the Senate is demanding urgent action to save lives. Lawmakers want both public and private hospitals compelled to stockpile essential life-saving antidotes, including antivenoms and antitoxins, as part of standard emergency care. The resolution followed the motion sponsored by Senator Idiat Oluroti Adebule, who warned that many victims die not because treatment does not exist, but because critical drugs are unavailable at the point of care.
Further note that with grave concern, the tragic and avoidable death of Mrs. Ifunanya Nwagene, who reportedly died following a snake bite in Abuja recently, thereby revealing serious gaps in emergency preparedness and antidote availability within public and private hospitals in Nigeria.
During the debate, the Senate referenced the reported death of Ms. Ifunanya Nwagene after a snake bite in Abuja, describing the incident as tragic, avoidable, and a clear indication of weaknesses in the country's emergency response system.
While we are condoling the family of the late woman, we have to be proactive as a government. I see no reason why most of our medical centers and hospitals all over the place shouldn't have medication for snake bites.
The bigger lesson for us is a need for us to have in place policies that must drive our health care. The fatalities that are caused by snake bites can be very painful and indeed avoidable.
As part of its resolutions, the Senate wants the availability of essential antidotes made a compulsory requirement for hospital licensing and accreditation, while also calling for improved funding and supply chains in public health facilities. The upper chamber further directed nationwide public sensitization campaigns on the need for immediate medical attention following snake bites or poisoning, and urged stricter building regulations to prevent snakes from accessing residential areas through drainage systems. Tijesu Adeoye, TVC News, Abuja.